Autoimmune diseases are challenging for both patients and doctors. When the body turns on itself, it can be difficult to manage, but progress is being made when it comes to Crohn's disease. Here's the latest in this week's Positively Healthy. Under normal circumstances, our immune system keeps the body in check, but for reasons we don't fully understand, it sometimes goes awry. The result is autoimmune diseases, including Crohn's disease.
Crohn's disease is an inflammatory illness of the intestinal tract, and it can really affect anywhere from the mouth all the way down to the anus. But the most common spot is where the junction of the large and small intestine.
Dr. Michael Cohen is a board-certified gastroenterologist. He says one theory is that our digestive tract turns on itself after wrongly identifying a normal bacteria as harmful.
The immune response triggers a whole inflammatory sequence, and this inflammation manifests itself oftentimes as what we would almost consider like canker sores of the bowel. And those canker sores can cause a variety of symptoms, including pain, changes in the bowel movements such as diarrhea, intestinal bleeding, and they can even lead to blockages of the intestine.
That said, Crohn's is quite literally a pain in the gut. There's no cure at this point, but major strides are helping patients better manage the condition.
Over the last 20 years or so, there's been a huge revolution in the treatment of Crohn's disease. We've actually isolated some of the chemicals in that inflammatory cascade, and we're able to target certain chemicals along that pathway and stop the inflammation at that point.
Current drugs are high-power weapons used to achieve remission.
So there are a wide variety of drugs. There are drugs that we call biologics, and at the moment, biologics are only administered either through infusions through an intravenous line or self-injections like a diabetic would give themselves insulin. There are other drugs called immunomodulators which are available in pill form, and we often use the two, and it's really revolutionized the treatment.
In some cases, patients are becoming virtually disease-free.
Where they have no symptoms, where their endoscopy reverts back to normal, and their blood markers and stool tests may revert back to normal. And that's really, at the moment, the holy grail.
While a cure may be elusive, with proper medications, Crohn's sufferers may find peace with the battle within.